got a lot of stuff on agenda. So welcome everybody. So thrilled to see you. Here we are, August 20th, Continuum of Care meeting. Where is the year going? It's like just zooming by. Next thing we know, we're gonna see what decorations out and about. Anyways, just want to say welcome to you all. Let's go ahead and move to the next slide, Ms. Zuli. Okay, so welcome and intros. I already mentioned making sure if you are a voting member that you click the link so that we can be sure to have a quorum, as we do have items on agenda today that we do need to take action on. So while you all are doing that, I am so excited to tell you that we have 2 new members. So they've been attending consecutively. We have 2 new Continuum of Care members. So Operation Grace and Empowered Pathways Residents LLC. Are either of you in the house today? And do you want to say hello?
Yeah, hi, this is Mark with Operation Grace, and we are in the house today. I'm here.
Perfect, welcome. So you're almost there for becoming a voting member. And then new voting members, RB House of Love and H3 Foundation. Are either of those organizations in the house today?
Yes, RB House of Love is here. Hello, everyone.
Welcome. Well, we're thrilled to have you as a new voting member. It's important to have your perspectives, your expertise, your voices represented. So we want as many as possible to be as diverse and smart and strong to do the best that we can right across this nation to serve all of the folks that are either at risk or homeless in our region and our 7,303 square mile county. How's that? So with that, let's go ahead and go to the next slide.
Hi, I'm so sorry. My name is Julie. I'm with Empowered Pathways. I just wanted to mention that we were here too.
Oh, great. Welcome. Thank you. We're so happy to have you.
Thank you.
Okay, so next is public comments. I believe we have not received any written public comments before the meeting. I just want to let you all know that if the CSE team receives them, they will be posted to the Google Docs along with everything else. So just as an FYI to you. So having said that, and knowing we don't have any that have been received, are there any members of the public that would like to address the Continuum of Care regarding items that are not on agenda? You have up to 3 minutes for your public comment. If you have a public comment, please raise your hand. You guys are quiet today. Okay, so let's see. We'll go ahead then. Going once, going twice. No public comments. All right, Zuli, let's move to the next slide. Okay, so I had a couple of updates for you as the chair of the Continuum of Care. I think Greg is on with us. Isn't Greg on?
Yes.
Okay, so however many years ago it was when actually Greg was the chair and I was the vice chair, that was a number of years ago, he and I worked collaboratively to change some things in how we operated the Continuum of Care. And one of them was to survey the members to make sure that we got feedback, and we're developing or structuring meetings that were meaningful to you all as members to make sure that we're on track for complying with, you know, all of our requirements, but helping it to be meaningful in this big collective effort. And just seeing what we can do to make sure that we empower you with the information and support that you need to be successful, because we are viewed as a whole region, like one big ship. So we're all successful together. So the idea is every once in a while to take a moment to launch a survey to get feedback from the Continuum of Care so that we can hear from you about how you feel about how we're structuring the information that is being presented to you, your ability to provide feedback, collaboration, training, you name it. So just know that in the near future, you'll see an email that will go out from the CSE email to the whole continuum of care. It will have a link to, I believe, a Survey Monkey, where you'll be able to complete a very simple, easy survey, and then the team will compile the results, and then we will report out the results and discuss them at a future meeting. So I'm looking forward to doing that once again, because it's important that you all have the ability to give feedback. The other update that I wanted to give to you is, as the chair of the Continuum of Care, I like to be able to partner with the county staff and host at our city every year, because I work with the city of Corona. We like to host and provide lunch for all the Continuum of Care members to come together in person once a year, where we can break bread together, give each other a hug, celebrate all of the good work that we're doing, recognize some really great things that have been happening out there. It's just important. It's nice to be able to have these remote meetings, because we're all doing 500 things and multitasking, but at least once a year. And it's not mandatory. We will have a remote option, as we always do. We recognize that it's a big county. So those that couldn't come to be there physically can still participate remotely. But we're just so privileged to be able to do that on behalf of the Continuum of Care. So it'll either be October or November. We'll be working with Tanya and her staff and looking at the availability for the room, and then we will report back out to you guys. So I wanted to just take a moment on the agenda to give you guys that update, to let you know that we are excited to be planning something for you to come together. So that concludes my updates as the chair. Let's go on to the next slide. Now, at this time, we have full business agenda item 4.1, which is the HMIS Rivco 1 Connect integration. And before Greg dives in, I do want to take a moment to not only acknowledge Greg, but Tanya and Emma and the other staff from HWS, and even the staff from behavioral health. And this is an effort involving all the county agencies. And I just feel so blessed to be a part of partnering with a county that cares so much to be able to do something like this to improve the quality of services for the people that we serve. So you're going to hear some exciting next steps about where we are with this really super cool project. So Greg, take it away.
Thank you, Karen, for the kind words. I appreciate that. I believe probably most of you were on the last Continuum of Care meeting where I did the presentation on the county's Rivco 1 initiative, which is our integrated service delivery. So it's been about a 4-year-long process with the county, but we're really excelling in implementing a real integrated approach to this. As part of that integrated service delivery, there's a data component to that, where we are working with Amazon Web Services, as well as a company called Slalom, to develop a database system where different agencies within the county can collaborate and share data, ideally making it easier on the residents that we serve, so that if they walked into an office and they are already registered with one agency, that their name and information would come up. Lots and lots of privacy protections around that. We have spent months, in fact years, working with county council to make sure that no identifying health information, domestic abuse, whatever, anything that would harm the residents. The overall Rivco 1 effort is to increase our Healthy Places Index score by 30 points over 30 years. And is really focused around social determinants of health. And Zulie, I think you have the next slide that I had in the presentation. Yeah, so in the presentation I did at the last COC meeting, I went over some of the HMIS issues that we need to address in order to participate in the Rivco 1 Connect system. And those are basically inserting language into the privacy notice, the consent for release of information, the interagency data sharing agreement, and the charter, just to allow us to share that data with RIVCO 1. Many of you may know that the county doesn't own the HMIS data. It really is controlled by the Continuum of Care, and so that's why we have to make sure that we update these 4 items in order to be able to participate in that. HWS is really proud because we're actually the pilot agency and pilot department for this RIVCO 1 Connect database system. We're also working though in conjunction with Department of Public Social Services, as well as behavioral health and RUHS medical system as well. So it's pretty straightforward on the amendments. It's really, again, just making sure that we're inserting the ability to share the information with RIVCO 1. Our unhoused residents at any time can opt out just like they can on HMIS. They can also do so on RIVCO 1. And then additionally, I think there's not an additionally though, but the overall goal again, is really to make sure that we're increasing the services we're able to connect, especially the residents that you all do such great work with. So with that, I'm happy to take questions, but the recommended motion, Zula, if you want to go back to the previous slide, would be to approve the revised privacy notice, release of information, and interagency sharing agreement and HMIS charter, subject to entering into an MOU with the county executive office.
So if we can entertain a motion, do we have a motion to approve the recommended action?
Michelle Davis with City of Riverside, I make the motion.
Do we have a second?
Second.
I'll second. Charles Chapman, Mercy House.
Do we have any abstentions or objections? Hearing none, the item passes.
Thank you all very much. We appreciate it. So.
Yes, and as I mentioned earlier today, Greg, next stop, NACO award submission. Because this, I think you should share with the Continuum of Care, Riverside County is kicking butt, right? I mean, compared to the other counties. You mentioned when I asked you this earlier today, there's only a very small few out of our, 58 counties that are even trying this.
Yeah, especially at the scale that we're trying to do it at. So
yeah. Okay. Thank you again. Let's go ahead and move to the next agenda item. Agenda item 5.1, homeless housing assistance and prevention, the HAP 6 grant community meeting discussion. Miss Amy, you have the floor.
Thank you. Good afternoon, Riverside County Continuum of Care. I'm Amy Primrose Puente, Senior Program Specialist with the Office of Homeless Services. Thank you all for being here today. We are in the midst of preparing our application for round 6 of the Homeless Housing Assistance and Prevention Program, or HAP, as you all know it. And I'd like to just take a few moments to walk you through the key system performance measures that guide our work, as well as our funding recommendations that we're putting forward for this round. So if you will go to the next slide, please, Ms. Sully. So the HAP program is overseen by the California Department of Housing and Community Development, and they set clear expectations for their grantees. And we're tasked with tracking and improving on a set of standardized metrics called the California System Performance Measures. These measures basically are our roadmap for assessing progress and preventing, reducing, and ending homelessness across our region. They're closely aligned with the U.S. Department of Housing and Urban Development's system performance measures, but they're tailored to California's unique needs. So we went over them last month, but I wanted to revisit them again. So we have 1A, 1B, 2, 3, 4, 5, and they are measuring things like how long does it take us to house people, how long is on average are folks experiencing homelessness on an average night. They ask, let's see, the number of people accessing services who are experiencing homelessness for the first time, exiting homelessness into permanent housing, average length of time that people experience homelessness while accessing services, percent of people who return to homelessness within 6 months of exiting homelessness. Next slide, please, Ali. Number of people with successful placements from street outreach projects. And then we have our racial and ethnic disparities. And so we're looking at increasing services, service access for underrepresented groups, reduction in disparities for overrepresented groups, a reduction in average duration for Black and multiracial groups, and then a reduction in return rates tracked via HMIS data. The super exciting thing to share is that we've met or increased all of our metrics besides two, which are the system performance metrics 3 and 6. So we're well on our way. We still have time. The deadline for those metrics are not until 2027. So we're in good shape. 2026 and 2027. So we're in good shape. And we'll see with the HAP round 6 that the system performance measures are just being built on. So we won't be adjusting those two metrics that we haven't met yet. But for all the other system performance metrics that we have met, they will stay the same. We'll just increase the actual. So if the actual benchmark was to see an increase of 10%, we'll increase it to 15%. So we're still making progress, but even more than we anticipated. So it's really exciting. And thank you for all the hard work that you all are doing to make that possible. Next slide. So just quickly to go over the eligible uses that HAP can fund, we have permanent housing solutions, rental subsidies, landlord incentives, move-in expenses, operating subsidies, supportive services, capital for permanent housing, service coordination. For homelessness prevention, we have rental assistance, rapid rehousing for households, diversion support to prevent unsheltered and sheltered homelessness. Next slide, please. We have interim housing solutions, low barrier navigation centers, emergency shelters, operating expenses for congregate and non-congregate shelter or youth transitional housing, motel, hotel vouchers, services, capital for new congregate shelters or youth transitional housing, capital for clinically enhanced shelters. There are some restrictions to note for the new interim housing. And then there's the non-housing solutions, which are street outreach, engagement, case management, harm reduction, and hygiene services, services coordination, support for lived experience participation, improvements to existing shelters. Wow, I love HAP. HAP is such a blessing in our community. They provide so many options to end homelessness. Next slide, please, Lily. It's exciting reading the list because it really, reminds you how awesome it is. Okay, so remember, we submit the HAP application as a regional application. So there's 3 parts of it. We have the COC, and we have the City of Riverside, and then we also have the County of Riverside. So the funding recommendations that are being put forward for the City of Riverside are on the screen right now. We have $3.5 million going to rapid rehousing. For the use set aside, rapid rehousing, $785,472.57. We have $500,000 going to prevention and shelter, 1.5 going to the delivery of permanent housing. That's so exciting. Operating subsidies, we have 3.7. Street outreach, we have 350,000, and then we have 724,830.80 cents going to admin costs. Next slide, please. All right, this is the one that has to do with us, the Continuum of Care. So we have a total being awarded to the Continuum of Care is $5,178,272.86. We have rapid rehousing, 1.7 going to rapid rehousing. The youth rapid rehousing is 517,827.29. Prevention and shelter diversion, we have 1.5 million going there. Operating subsidies, 500,000, and street outreach, 1 million. Administrative costs, 362,479.10. So that is our Continuum of Care award recommendations that we're putting on the HAP 6 application. Next slide, please. And finally, the last award to review is the Riverside County Award. The total award is $4,848,492.04. Rapid rehousing, we have $1,084,851.58 going there, with youth rapid rehousing, excuse me, $484,849.20. Prevention and shelter, we have 1 million. Operating subsidies, motel, hotel vouchers, we have 1.9. And then operating subsidies for interim housing, we have 500,000. And finally, $339,394.44 going to admin costs. Next slide, please. Okay, so that was just a quick overview of our system performance metrics and the funding recommendations going on our HAP 6 application. We invite feedback. There is a link in the chat to a feedback form. If you have, we invite you to share your feedback with us. We'd love to hear from you. Our application is due on the August 29th, so it's just right around the corner. So please get your feedback in so that we can use it while we're finishing up our application and finalizing our award recommendations. If you have something to add now, please, Miss Karen, I see your hand.
Yes, good job. And I just want to take a moment to acknowledge the beautiful collaborative effort. You know, our lovely Vice Chair, Michelle Davis, is with the City of Riverside. And it's so great to see that the City of Riverside integrated into this process, because it gives everybody the big picture regarding the state allocation. Just a dumb question, but in case anybody had it in their minds, assuming for the City of Riverside, any applicants that are solely serving in the City of Riverside only apply to that bucket and wouldn't be applying to the other buckets. Would that be correct?
That's correct.
Okay. There's
And then Karen, just to follow up to that, last night, yesterday afternoon, City Council did approve the City of Riverside's HAP Round 6 funding plan, and also the MOU amendment with the Continuum of Care and the County of Riverside for supporting the Riverside County's Homeless Action Plan, which is required as part of the application. So we got past that hurdle yesterday, and so looking forward to submitting that state application next week.
awesome.
Yay.
Thank you.
This
Do
is
we
a
have
lot of
any other-
opportunities, you guys. Come on. This is like, woohoo. We should be like doing backflips. This is like resources. Everybody, you know, is worried about there's not going to be any money. Not everybody, but some people were worried. And I think this is something to take a moment to celebrate all of these great opportunities. And HAP tends to be a little bit more flexible than some of the other funds. The county staff are shaking their head. Michelle is shaking her head. So yes, this is really a great opportunity.
And Karen, I just want to add one thing, something we're looking at the City of Riverside, which I think we'll probably have to look across the whole county, is our permanent supportive housing and rapid rehousing. When we're putting folks into housing, are there the resources to pay for their life skills needs, as well as cleaning supplies and household items? I was even brought to my attention by one of our county partners that IHSS workers that are assigned don't come in with cleaning products. They're relying on their clients. When if the clients don't have those cleaning items, then their units aren't going to be cleaned. So how can we support our nonprofits that are doing the great work? So we're going to be reaching out probably to some of the members here to talk about how we can get a community donation drive started, and then maybe roll that out countywide.
So just
So
one
stay
last
tuned for that.
question, because I know that all of this is being presented as one integrated effort. Does the city of Riverside see like a report back for the just like that we will be doing on the Continuum of Care side, or when you get through your selection process?
Are you talking about for the funding or the?
Yeah, the recommendations for who's
Yeah,
getting
we'll
funded.
definitely bring that back to the Continuum of Care and share that out. And then when we're releasing NOFAs, we'll make sure that we share that with the COC as well.
Awesome. Good job, you guys.
Thank you.
Thank you. Thank you to you and Amy and your team.
Thank you.
There's a
Okay, you all
question
are
in the
so quiet
chat.
today.
Madam Chairwoman, there is a question in the chat from someone regarding the application being limited to COC members or open to nonprofit organizations within Riverside County. Amy, did you want to answer that?
Thank you,
Sure.
Emma.
I was trying to see the question. The awards from the state of California are will be awarded to the COC, the city of Riverside, and the county of Riverside. From there, those three entities will make the funding available to our nonprofit partners. We'll release it for the competitive bidding process, and then you can apply for the funds then.
But it's not limited to just Continuum of Care members, right? It's not just eligible nonprofits.
Correct, yes.
Yeah. Susan, did you have a question? Uh-oh. Miss Susan, are you there? Oh, I think we lost her. Oh, no.
See, you hear me?
There we go.
Okay, so no, that was the same thing I was going to clarify, that they didn't have to be COC members. Thank you.
Always nice to hear from you. Is there another question in the chat? I'm sorry. Oh, timeline. Ayoka is asking about a timeline.
Yes, the application is needs to be submitted. It's due on August 29th of this year.
Hey, thank you for the comment, Lindsay. It looks like you guys are doing some cool stuff too about gathering donations and cleaning supplies. So yes, good job. Any other questions or comments? And just know you have those contacts there that are listed. So if other questions, requests come to mind, you know how to be able to follow up. Okay. We'll go ahead and move to the next agenda item then. Agenda item 5.2, the fiscal year 25 HUD Continuum of Care Project scorecards. Catherine, you're on deck.
Hi, good afternoon, everybody. My name is Catherine Wormley. I am the Senior Program Specialist for Office of Homeless Services. I will go over the scorecards today for the new 2025 NOFO. Next slide, please. All right, quickly before I get into it, I have two updates. So for the 2025 NOFO update, we are working closely with our HUD rep and our HUD consultant to ensure we are updated on the latest news. As of today, the 2025 NOFO has not been released, but correspondence will go out as soon as it is. And then secondly, there is a disclosure added on both scorecards. The scorecard must remain compliant with the current HUD standard. Should HUD update or revise these standards, the scorecard will be modified accordingly, to ensure continued alignment and compliance. So I will get into the renewal project scorecard right now. The first section is the eligibility threshold. It is no longer a point system. It has changed to a pass or fail. These criteria are HUD mandates and must be met for applicants to be considered. Next slide, please. Next slide, please. Thank you. So 4 criteria has been moved from the eligibility threshold to program compliance, numbers 12 through 15. Number 12 is housing first. All of them, including the Housing First, will not be a HUD priority for this NOFO, but still remains important among COC priorities. As a result, they were moved from eligibility threshold to into the local scoring. The points for program compliance increased to 41 points. To make room for these 4 measures while still being appropriately proportioned to other compliance sections. Next slide, please. All right, the HMIS scoring amount went back to the original 2024 scorecards from 2 to 30 points as we move toward emphasizing the importance of data quality and timeliness. For renewal projects only, the timeliness to enter data remains at 7 days to capture data quality for the 2022 grant period. Lastly, overall score increased to 121 points as the overall threshold remains at 80% or 100 points. Next slide, please. All right, this is for the new projects. Again, the first section, eligibility threshold. As you can see, it is no longer a point system for new projects as well, but a pass or fail system to comply with the HUD mandates. Next slide, please. And one more. Great. Like the renewal project scorecard, numbers 12 to 15 were moved from the eligibility threshold to the project design, increasing the total points for that section to move, or increasing that total points of that section to 35 points. Next slide, please. And one more. All right, HMIS compliance is also 30 points. For new projects only, timeliness will reflect the new HMIS requirement of 0 to 3 days for data entry. But please be advised that 0 to 3 days will become the standard for future NOFO scorecards for both new and renewal projects. And lastly, the overall score totals is 125 points for the new project scorecards with the same threshold of 80% or 100 points. And that is it. Next slide, please. I think that's it for me. Yes, that's it. Back to you, Madam Chair.
I believe Susan has a question.
It was a little hard to hear your voice. It kind of cut in and out, but
Okay.
I think my main question that I sort of globbed onto was the 3 days HMIS requirement, because that's a new requirement. And normally the scoring on this is for the prior year. People are probably not going to have met that 3-day threshold yet because it's new. How is that going to be handled?
Yeah, so for the renewal projects, we are looking at the 2022 grant period, and the timeliness for data entry is going to remain at the 7 days, because we do understand that the new mandate for the 0 to 3 days entry is just passed. So for the new projects alone, the 3 days will remain, and then any NOFO moving forward, let's say 2006 and onward, it will change to 0 to 3 days.
Thank you.
Mhm.
Any other comments or questions? Okay, hearing none, let's go ahead and move on to the next agenda item.
I think we have a motion that we need to,
Oh, I'm sorry.
thank you.
Okay, well, we get back to the, what's the motion that we're doing here? A recommended action.
The action is to approve the fiscal year 2025 HUD COC project scorecards to be used for the renewal and new projects.
Okay. Do I have a motion?
Michelle Davis, City of Riverside, I'll make the motion.
Thank you, Madam Vice Chair. And do I have a second?
Charles Chapman, Mercy House, I'll second.
Thank you, Charles. Do I have any abstentions or objections? Hearing none, the item passes. Let's move on to the next agenda item. At this time, we're going to move to approve consent items. We have consent item 5.1, approval of the July 23rd, 25 Continuum of Care meeting minutes. Do I have a motion to approve the minutes?
Chris Oberg, Path of Life, move to approve.
Thank you, Chris. Do I have a second?
Charles Chapman, Mercy House, I'll second that.
Thank you, Charles. Do I have any abstentions or objections? Hearing none, the item passes. Next agenda item. Standing items, CSC lead agency update. Miss Emma, you're on deck.
Thank you. Good afternoon, everyone. Thank you so much for joining us in our monthly COC meeting. Next slide, please. Some quick updates for you. First off, we have our Board of Governance meeting tomorrow. So I wanted to provide a reminder to all of the COC members. That meeting is an in-person meeting. We also have a virtual option for those of you who can't join us in person, but we will be at the City of Banning City Council chambers tomorrow from 9 to 11 a.m. So if you can join us, please do. If not, the virtual option is there for you as well. I also, for our cities that are on the call, I wanted to just make sure you were aware that I think it was yesterday or the day before, HCD announced that they are going to be releasing the round 5 of the encampment resolution funding. And that is something that we are anticipating maybe later in 2025. I know we're already in August, so sometime in December or in early January 2026. I just wanted to put that out there to make a mental note of that. There'll be further communications once we hear official word. We will send that out through the COC, but just make a mental note of that since we did get that communication yesterday from HCD at the state. Additionally, wanted to make everyone aware that we do have HMIS office hours coming up on the 28th of August from 2:30 to 3:30 p.m. This information is disseminated through our HMIS newsletter, but just wanted to highlight that our HMIS team has these monthly office hours as a virtual option for participating agencies. And really, it is an opportunity to ask HMIS related questions and receive additional technical assistance and mini trainings on HMIS. So I would encourage all of our HMIS using agencies to take advantage of this. If you have staff that have questions or need additional support, that's what those office hours are intended for. So please take advantage of it. We have had a really great participation thus far, a lot of really great conversation happening around HMIS, and we would like to keep that going. So please do take advantage of that time. And that is pretty much it for my updates. I'd like to turn it over to Marielle Sarmiento, who is our project manager for YHTP. She has a quick announcement for you.
Oh, wait, before we go back, can we go back before she switches?
Sure.
Ms. Emma, we talked about this before. I think it's important to mention this. We're looking at fairness and equity across the region. Some of the important decisions that we need to be talking about are making sure that if there are regions that haven't benefited from funding, that we want to make sure that we do that. And I think we alluded to with the next round of the ERF funds that it would be important to make sure we're looking at the regions that have not received those funds yet.
Yes, and the beauty of the ERF funds is that the county can apply, but so can a city. So as an example, the last round of ERF, the city of Palm Springs applied for their own specific encampment site. And we were also awarded the Marietta Creek site, which covered the southwest region of the county. And the county sponsored that application, but we also partnered with the city of Palm Springs to help support the efforts going on to mitigate the encampment that they submitted for. So we are more than happy to coordinate, but we do encourage cities to apply for funding so that we can maximize the amount of money that's coming into our county.
Great, thank you.
You're
Appreciate it.
welcome.
Okay, next slide.
Alrighty, thank you, Emma. Hello, everybody. My name is Mario Sarmiento, and as mentioned, I am the program specialist managing the Youth Homelessness Demonstration Program. And we are happy to announce that our Western Region Drop-In Center is open and actively providing services. And we wanted to share this with you all since we know we have many providers who are either specifically working with youth or just happen to serve youth. And so we wanted to make sure that this resource is available to you all. It's located in Moreno Valley, along Ellsworth, right by the March Air Force Base. And I believe we have Miss Kenesha Jones on the call, who's the Executive Director of Silence Aloud. And Silence Aloud is the agency that runs the bridge. So I'll pass it over to her to speak more about the services they provide.
Hello,
Thank you.
all. Can you hear me?
Yes, ma'am.
Okay. Hi, I'm Kenesha Jones from Silence Aloud Incorporated. And yes, we're very happy to announce that the Bridge Wellness Center location is open as the YHDP Youth Drop-In Center. In Moreno Valley, we're right off of Ellsworth and Cactus. In Moreno Valley, we are open from 10 a.m. to 8 p.m. Monday through Friday, and we take walk-ins and then appointments on Saturdays. So anyone can walk in. Our population served under YHDP is 24 and under. We are designated for this side of the county as a central access point for the coordinated entry system for homeless or at-risk youth. We provide housing-focused case management, system navigation. We have peer support specialists, life skills and connections to education, employment, behavioral health services. We have walk-in Wednesdays for behavioral health services and groups Wednesday evenings. Financial supports include transportation assistance, emergency basic needs, vital documents if they need IDs, birth certificates, security deposits, assistance with utility payments, and so a variety of things under that program. And we really just encourage everyone to send youth in that demographic to us. We're excited to serve. We also have another county funded project under probation. It's called Rise Up Youth Empowerment Program. It has very similar services to the YHDP in terms of the supportive services, but it's more focused on justice involved youth or those that are at risk of justice system involvement. Special services for victims of trafficking and or survivors of trafficking. And the program is much more heavily intensive on the life skills and behavioral health side. And so we just encourage you guys to send everybody our way. We're excited to serve. We also have a program called Artivism, and that uses arts as a healing modality for youth and as a means of social activism. So we have a lot of stuff going on under that, and feel free to reach out to me directly if you have any questions. And if anyone has any questions now, I can answer them.
So is the
Thank you,
question
Ms.
in the
Jones.
chat? There's a question in the
Yes.
chat about the hours of operation.
I'm sorry, say that again.
There's a question in the chat from Michelle
Oh.
Davis about the hours of operation.
Let's see. We're 10 a.m. to 6 p.m. 8 p.m. Monday through Friday, and then Saturdays by appointment.
Any other questions? Let's see. See any hands raised?
Yes, we definitely, Mark, I'll put my, for everyone, I'll put my information in the chat and you can reach out to me. I'd love to give anybody a tour, especially other YHDP providers. I know we've reached out to a lot of you guys, but definitely want to create tighter partnerships and looking for partnerships as well. Our concept is the overall location is to be a one-stop center. So we're happy to be building that vision out with the YHDP and Rise Up programs, but still have more to do in that regard.
Very exciting. It's we're going to start to see different elements of YHDP coming to fruition. There's so much work that went into the development of the plan and rollout of the RFP and selection of agencies. And Maria, love your collaborative spirit in getting the word out. So we just want to thank you. We're super excited to hear about this beautiful asset in the community and hope that a lot of TAs get helped.
Yes, thank you.
Miss
And we
Emma?
will come to youth if transportation is an issue. We can meet them where they're at. So don't let that be a hindrance for anyone that you know needs to be getting some services.
Okay, that's great to know. Miss Emma, did you have a question?
Not related to this, so I can wait in case anybody else has a question related to the YHDP drop-in center.
Okay. Anybody else?
Oh, and
thank
B
you.
Hunter, I see that your comment. I've actually have been wanting to connect with you, so absolutely love to give you a tour.
Perfect. Thank you so much. Great work.
Keep the collaboration going, you guys. Don't be shy. This is another moment of celebration for more resources and collaboration. That's what we need to be doing. So take advantage of it for sure. Anybody else have any more questions or comments? Okay, thank you so much. Miss Emma, before we go to the next agenda item, did you have a comment?
Yes, thank you. I was remiss in not mentioning this during the previous item regarding the HUD COC scorecard. So at the last meeting, we provided an update to the COC that we had received notification from HUD that there were going to be some potential changes and priorities with the release of the new 2025 HUD COC program. And so contingent on what is included, we have not really gotten too much information aside from what was already shared with the COC. So if we get the NOFO and there are significant changes to priorities and the scoring methodology, what we plan to do is send an email out to the COC to convene an ad hoc committee to decide on how we need to adjust our scorecard and any other processes that we have been following as a COC. So I wanted to make sure that's like a really important piece of information that needs to be shared with all COC members. So I wanted to make sure that that was clearly communicated to everyone. We have been told that the COC will drop sometime in early September. So as soon as we know, we will be communicated via email to everyone. So just again, mental note on that, more to come. Thank you.
Okay, let's go ahead and move on to the next agenda item. Okay, 7.2, coordinated entry system lead update. Ms. Lucy, you have the floor.
Hello, can everyone hear me okay?
Yes.
Okay, so we are going to be looking at the data trends for the month of July, and we'll also be going over some areas of improvement that CES has identified. Next slide, please. So regarding the Home Connect call specifically, there were 849 phone calls in the month of July. Of those calls, 643 of them resulted in diversion by providing resources to prevent homelessness or eviction, while 192 of the calls were screened and linked to the coordinated entry system. Of those screened, 43 were families, 3 identified as veterans, 20 were of the ages of 55 plus, and 14 were of transitional aged youth, while the remaining phone calls were either out-of-county callers that were redirected to the appropriate county's contact or general inquiries such as updates on their process within CES, who their worker was, etc. Next slide. And the end of July accounted for roughly 921 members on the community queue. When looking at the cities with the highest numbers of residents that are on the queue, there was a drop for Riverside, at least, at roughly 3%, from 271 to 262. Indio's queue saw a slight increase of 13 residents added, as did Palm Springs, with around 27 households that were added onto the queue. While overall there's a general uptick between the months of June and July, CES does see this as a positive note that more people are being connected and put through our coordinated entry system, finding the help they need. CES referred 80 households last month to housing opportunities, 50 of which were connected to permanent supportive housing and 30 to rapid rehousing. Next slide. So for areas of improvement, CS will be holding referral status check-ins to touch base with navigators and agencies that request vacancy referrals to ensure that Home Connect referrals are not left in limbo and are closed out, whether it is to a successful match to ensure that vacancies aren't left open for a long period of time, or to ensure if the client is declined by the agency or declines the opportunity, that Home Connect can provide the opportunity to another member in a quicker fashion. CS has also identified patterns of error in data and will be working with agencies to train in running data quality reports to ensure that data is accurately depicted in clarity and ensure visibility among the COC and reduce lapse of services. HMIS is also partnering with the coordinated entry system to provide trainings during CES partnership resource meetings, and CES will partner with HMIS to provide trainings and information during their monthly office hours. Next slide. We are requesting agencies to present. We're currently scheduling for the last leg of the 2025 year for our partnership. If you are part of an agency or aware of any resources that are specific to Mid-County, justice involvement, or agencies that are offering rental assistance, please let me know either in the chat or reach out to me directly. Next slide. And we're always looking for feedback on what agencies want to see more of within CES in order to address the needs that can help us run the coordinated entry system as efficient as possible. So feel free to reach out to myself or Home Connect for any feedback or recommendations. And that is all I have. So if you have any questions, please reach out to our CES team members. We have our admin services manager and our admin services supervisor, Monique and John, and of course myself, the social service planner for the coordinated entry system. Thank you.
Any questions or comments for Lucy? Well, I certainly just want to take a moment to thank Lucy and Monique and John and the team. Whenever there are need for collaboration and coordination, you guys are always just so phenomenal and deal with so many organizations across the region. We just want to give you some love and say thank you.
Thank you.
It looks like Michelle has a question or a comment.
Yeah, just a quick question. I don't know if you can answer it, Lucy, or maybe somebody from HMIS. I know we've been talking about the VI SPDAT and looking at implementing it in a different tool. So I don't know where we kind of left that off at.
I don't have that answer. I know we are trying to transition away from it, but as a set date, I don't think we've gotten to that yet. And if we have, I don't have the knowledge of it.
Thank you.
No problem.
I can jump in really quickly with an update. The team is working really closely with the contractor, and Monique and the HMIS team have a meeting scheduled next week so that they continue to have conversations around what that looks like, to make sure that the servers are all working correctly and we're pulling the correct information. So as soon as we get any updates, we'll share them out here.
Thank you, Larissa. It's nice to see you, and thank you to you and your team too for all the great work.
Thank you.
Okay. Any other questions or comments? Did we have someone who had a comment? Okay. All right. We can move on to the next agenda item, 7.2A, functional zero on veteran homelessness.
Good afternoon, everybody. My name's June. I work with Lucy, John, and Monique at the wonderful coordinated entry system. I think this is my first time presenting at this meeting, so it's wonderful to meet everyone. Some of you may have had the pleasure of being at a training with me or the displeasure of receiving an email from me. So this afternoon, I'm going to present a very short introduction to Functional Zero, which is a concept aimed to ending veteran homelessness. Do we have any people on the call who specialize in veterans outreach or just have a lot of veterans on their caseload? Hopefully this presentation is relevant to you. But even if you don't, I think you'll find that a lot of these concepts is relevant to ending homelessness in general. All right, so we can move on to the next slide. So functional zero, what does that mean? It means that no veterans will experience long-term homelessness. If there is any homelessness, it's resolved quickly. And the goal is to be consistently near zero. You know, from a practical level, we know that being at zero every day of the week is not feasible, but the goal is to be at zero with our efforts, and also to provide support services immediately and effectively to veterans. Next slide, please. So we need to measure functional zero in a certain way, and I apologize if the gray is a little bit hard to see. So for our communities, we're going to track veteran homelessness using data and clear criteria through 5 main methods. I'll introduce them more detailed in the next coming slides, but first are the point in time counts. Second, housing placement rates. Third, average lengths of homelessness. 4, housing stability post-placement. And lastly, system capacity and responsiveness. So we'll go over the first one in the next slide. So the point in time counts, these provide a snapshot of homelessness on a given day or night by counting the homeless veterans in shelters and on the streets. Some of you may have participated in the yearly point in time count, so you're familiar with this. Second would be housing placement. We're going to compare how many veterans are housed each month versus how many become homeless in that same month in order to measure how responsive our system is. Next slide, please. The next measure is the average length of homelessness. We're going to track how long veterans remain homeless before they're housed, and our target is shorter durations in order to show that we're serving them more effectively. Number 4 is housing stability after they're placed into a program, because we want to monitor whether veterans stay housed after placement or if they return to homelessness. This way we can determine our long-term success of our housing solutions. And on our next slide, we'll have number 5, system capacity and response. We need to assess whether our availability of emergency shelters, rehousing programs, permanent housing, and outreach programs, whether they actually meet our current needs. In easier terms, do we have enough beds and rooms for the number of homeless that we have in our continuum of care? Next slide, please. So how can we achieve this? How can this be possible? First is real-time identification of homeless veterans, either through street outreach, in-reach, or walk-in members, if there's an access center in your particular agency. Second, the coordinated entry system and the referral systems that the coordinated entry system works with. Third would be permanent supportive housing options with on-site case management. And lastly, collaboration across agencies and organizations, such as the meetings that we're having right now. Next slide, please. Also, we're going to shift our perspective from only counting how many homeless veteran members out there and shift towards how quickly can we house them after becoming homeless, and focusing not necessarily on the problem, but on the solution. Next slide, please. So how can we see what successful implementation of functional zero looks like? First would be housing placements. We have to make sure that our housing placements are keeping up with new cases, not having a backlog of unsheltered veterans. And we also want to make sure that they stay housed and supportive long-term, like I mentioned before, with on-site case management and continued supportive services. And this slide, I'm going to clarify. We want to make sure that homelessness among veterans does not become a systemic problem. So we all acknowledge that it is a systemic problem. So just want to clarify that bullet point. And if it's successful, we'll provide dignity, stability, and support to the veteran homeless population. Preventing homelessness will also reduce health risks, trauma, and mortality for whole person care. And in the end, we'll build stronger and more resilient communities. Next slide, please. So other ways that we'll achieve this is partnering with the Veterans Administration, the various continuums of care, nonprofit agencies, and housing providers. And we want all of them to have access and participation in the coordinated entry system, HMIS, and also to share resources and data for better outcomes. There's abundance of opportunities and education out there, but if we don't share it, we'll never get to be able to pass those on to our members. And we also want to focus on rapid rehousing and preventing homelessness in general. Rapid rehousing programs can provide short-term rental assistance and housing navigation, a really wide range of services and not just a subsidy. And by supporting programs to prevent homelessness before it starts and helping veterans maintain housing stability, whether they're self-housed or receiving services through a rapid rehousing program. Next slide, please. We also want to use data to drive action. HMIS not only is a way to make referrals and to leave notes, but it also provides a lot of wonderful and valuable information about our performance. And we can use that data to track our outcomes and identify gaps and improve programs, and also to use real-time data for decision making. I recently dropped in on a meeting where we can actually use pinpoint GPS data to identify encampments in the San Jacinto River bottom, where there's not necessarily streets or landmarks to identify, but you can actually drop an exact coordinate and identify encampments. So a lot of wonderful things are happening behind the scenes to support the case managers out there. Next slide, please. And in summary, we also want to advocate for resources and policy, not just within our offices, but within government as well. So we want to support funding initiatives for veteran homelessness programs, engage policymakers on housing, healthcare, and benefits, and also raise community awareness and support. And the goals of those three things are to organize community campaigns to reduce the stigma of homelessness among veterans, partner with businesses in the community, faith groups, and also volunteers, and also to expand the support networks available for veterans. Next slide, please. So to wrap things up, if we can summarize everything into 3 points, ending veteran homelessness requires a coordinated system. Our organizations play a vital role in rapid rehousing and support. And with all of our efforts together, we can achieve and sustain the concept of functional zero for our veteran population. If you have any questions, you can always contact our Home Connect email, and our phone number is right there as well. And this is more for any members that you're working with. If they're looking to seek services, not just veterans, but anyone in general, just a reminder, our Home Connect hotline is available at that 800 number. Definitely the most important phone number for our agency. If you haven't jotted it down, written it on a Post-it note, written it on your hand, definitely keep it there. If there's any questions, I'll be happy to help address those.
Well, first of all, I want to say thank you. It's lovely to have you. And we are super, super excited about this initiative, especially since at one point in our region, we had achieved functional zero. So it'd be great to be able to get to that point again for our veterans. So the one thing I wanted to just throw out there is, and I may have misunderstood your slides, but my understanding of functional zero is that the objective is to make sure that you have no street homeless and that people are immediately connected to shelter and then moved on to housing, because and that they're in there a shorter amount of time and that their episodes are less. And I may have misunderstood, but it sounded like what you was saying is functional zero is measured by street and shelter homelessness, which is almost impossible to achieve that objective. Did I misunderstand?
No, your understanding is more correct.
Okay.
As much as we want to strive for we understand that sheltered homelessness is merely a band-aid, and the end goal is to self-house all of our veterans or all of our homeless in general. That'd be correct.
Yeah, so if we achieve it again, it's basically we don't have any homeless veterans on the streets, and they may be in various forms of shelter and hopefully quickly and then on their way to housing, right?
Correct.
Yay! Okay, just wanted to make sure. Because sometimes, for messaging for all of us, when we're trying to explain and message to the community, people say you can never end homelessness, right? There's always people moving in homelessness and always people are moving out of homelessness. So anyways, I hope that distinction, I know it's a helpful clarification to me. So I just want to say thank you.
No, thank you for bringing it up.
Yeah, for sure. Any other questions or comments? Okay, let's go ahead and move on to the next agenda item then.
It's me
7.3
again.
Housing Resource Update, Mr. Greg Rodriguez.
And Zuli, if you can go to the next slide. Actually, I think Zuli, so I did the state budget and House update at the last CLC meeting. So Zuli, if we can advance to the Senate. Advance again. Yeah. Yes, right here. So since the time of the last update, I had gone over the House Appropriations recommended budget. Since that time, the Senate Appropriations Committee has met. It's a little better news than the House budget, but still definitely doesn't fulfill the need that we have. So just want to highlight some of these major proposals. 2.9 billion for Workforce Innovation Opportunity Act. I included that because obviously we're Housing and Workforce Solutions Department, and we know that we want to tie those we help get into housing to actually get into the workplace environment as well. On the tenant-based rental assistance, they're proposing 33.97 billion for contract renewals and that's about a $1.8 billion increase from FY25 and from the flat funding level that was proposed in the House bill. The bill unfortunately does not cover the cost of continuing the emergency housing voucher program, which serves over 59,000 households right now. The homeless assistance grant, which is a measly amount from the federal government, but program funding would increase 479 million for a total of 4.53 billion FY26. So it is good news that they're increasing it, but still really not meeting the needs. So next slide, Zuli, please. The bill would increase funding for other vital HUD programs, including the project-based rental assistance, Section 202 housing for the elderly, Section 811 housing for people with disabilities, and the HOPPA program as well. The Senate bill rejects, like I said, many of the drastic cuts included in the House bill, including a proposal to zero out funding for the Home Investment Partnership Program. Instead, the bill will provide the home program with 1.25 billion, which is level funding from the previous year, but at least they're not cutting it like the House proposed. And additionally, the bill would provide level funding for HUD's fair housing programs at 86 million. The House bill would have slashed that to $29 million. And then last slide, Zuli. The Senate bill doesn't include the problematic policy changes in the House bill and those that were proposed by Trump, by the Trump administration to impose harmful, arbitrary 2-year limits on receiving HUD rental or homeless assistance. There is also another rumor, it's not in the slide because I just saw it day before yesterday, the proposal, at least thoughts from President Trump to decrease eviction protection and actually allow landlords to evict within 15 days instead of the 30. That's problematic. So of course we'll monitor that. And then the final paragraph is obviously at the federal level, and many of you know this, we go through continuing resolutions constantly. So ideally, both the Senate and House Appropriations Committee we'll send these to the floor, and then there'll have to be negotiations within both houses of Congress to come to agreement on the funding levels. So you'll most likely anticipate the House won't get all the cuts at once, but the Senate may not get all the increases. If that's not done by October 1st, then we probably will see a continuing resolution. So those are the updates on federal policy, and no real news from the state. They passed a 7th round of HAP. I went over that last meeting. But we've been working with statewide coalitions on some what's called trailer bill language. So that's language within the legislation on what's required in order to qualify for HAP. And there's been some problematic requirements within that. So we're addressing those in what we're calling trailer bill language. And we should hear some indication on where the guidance is going to go from HCD relatively soon. So happy to take any questions if there's any.
Michelle?
Greg, thank you for the update. Just a quick question on the AHV clients. Do you know how much how many vouchers we issued in Riverside County? And if that program is not funded, is there enough vouchers on Section 8 to absorb them, or is there going to just have to through nutrition?
I don't know that, Michelle. I'm sorry, and I should have got that because it's a great question.
I can answer that. I can answer that for you, Greg.
Okay, good. Thank you, Hetty.
Hi, Michelle. Don't quote me on the actual figures, but it is around 350, and all of them were issued, and they are still housed to this day, and there is absolutely sufficient funding for us to transfer them and take them on into our regular program so that no one will lose their housing as a result. Thanks for the question.
Yay,
Awesome.
thank you, Heidi.
Thanks, Heidi. Appreciate that.
Any other comments or questions? Great, thank you so much for the important work you do keeping your finger on the pulse for funding and legislation and everything else. We appreciate you so much. Okay, next agenda item. Okay, informational items. You'll see that there are committee reports. They are in the Google Drive. And then also, yay, Michelle and I got to sign 2 letters of support, Rise Above Defeat and the Tiffany Inner Healing Project. So we always encourage you all, if you're looking to apply for grants, it is our privilege to be able to serve you and many different agencies. Funders do require collaboration with Continuum of Care, and we always want to do what we can to bring more resources to the region. There are no APRs in the Google Drive for you to review at this time. Next slide, please. At this time, we can entertain any suggestions for agenda items for future meetings. Does anybody have any suggestions? Okay, next slide. At this time, we can allow for members of the Continuum of Care or all of those attending to make an announcement. So I'll entertain announcements from the group, Michelle and then Renee.
Just wanted to do a shout out. This August month is Nonprofit Recognition Month. So I just want to give a shout out to our great nonprofits that do the great work in our communities. The City of Riverside is hosting a resource fair on August 26th from 8:30 to 11:30 at Hunt Park, which is at 4050 Jackson Street. I'll try and drop the flyer in the chat box. And then the City of Riverside, we merged our youth homeless case conferencing meetings with the County of Riverside. So our first meeting kicks off on August 25th at 3 p.m. If you would like to participate, I will drop Jasmine Contreras' contact information in the chat box.
Perfect, thank you. And Renee?
Good afternoon, everyone. Great to see everybody at our, monthly meeting. But I have great news from the Housing Support Program over here for CalWorks. We applied for a little bit more money or requested money for this fiscal year, and we got an additional almost $7 million for this year. So we're excited to start utilizing that funding for the families who are homeless in our county. And if anybody doesn't know what the CalWorks Housing Support Program is, it's for families who are on CalWorks. So they have to be active CalWorks and receiving that cash aid element in addition to the CalFresh and Medi-Cal. It's all bundled into one. And what the housing support program does is it offers temporary shelter vouchers, 16 days. We're doing a little bit more of an extension right now for those families that are in our program, but also we do rapid rehousing services. We partner with our wonderful Department of the Housing Authority, and we have great resources over there, and they do the landlord mediation and the housing navigation. And then we provide subsidies for those families who find housing, which includes first, last month's rent, rental subsidies, and security deposits. So we look forward to partnering with anybody, and if anybody should have any questions, please feel free to reach out to me at any time. Thank you, everyone.
But I just wanted to give you a shout out like I always do. You guys do such an amazing job, Renee. Thank you. And I think, we heard earlier, I think it was Lucy who said there's a trend. We saw a lot more families, right? And we're certainly seeing it. And you guys are such great collaborators. As we see a lot of folks coming from the school district, the families with kids, and it's so great to be able to leverage limited resources with you. I wanted to ask a clarifying question. Forgive me, I may have forgotten this, but so HSP, do you only post in HMIS at the point for rapid rehousing, or are you posting when they're getting their motel assistance?
Once they're approved for the housing support program, they are entered into HMIS. So they should be in there, and that's when they start receiving the hotel motel vouchers.
Okay, so that is really good for our team to know, because for some reason we were thinking it was only at the point that they would be shifting to rapid rehousing. So if we don't see them in there, that means they haven't received the motel assistance.
Correct.
Okay, perfect. Well, congratulations on the extra resources. Woohoo!
Yeah, we're super excited.
Any other updates? Come on, you guys. We need the good news because this work is hard and we need to be refreshed and renewed together. Anybody else? Okay, next slide. Okay, well, everybody, we're going to be adjourning the meeting. I can't wait to see your lovely, wonderful faces at our next meeting. There's the list of the upcoming meetings. Keep doing the great, fantastic work that you do, transforming lives. We just appreciate you all so much. Have a beautiful rest of your day.
Bye, thank you.